Hi, in this video we'd like to talk about hyperemesis and bloody vomit. Bloody vomit is another uncommon scene that you'll observe during pregnancy. Now this is a very distressing symptom. This could be very anxiety inducing and can actually lead to some mental stresses as well when women actually see blood in their vomit for their first time. Now this is not uncommon for HG patients, however. Now, if you do not have HG, then it is something entirely different that needs diagnosis. However, for HG patients, this is actually a common sight. Now, blood in vomit is actually caused by some tearing of the GI tract, specifically the upper GI tract. So it includes the mouth, the esophagus, and also the upper stomach, and also the opening of the sphincter entering into the stomach. So esophagus and the stomach opening. These places, they're actually constantly spasming. Because why? HG patients are constantly violently vomiting. But this constant violent spasming leading to vomit, it actually can cause tears of the tissues of the upper GI tract. Now wherever they happen, these places are all covered with veins, muscle tissues, smooth tissues, and nerves as well. So when they're constantly spasming to the limit, now some form of secondary damage will happen. Furthermore, in the stomach alone, because of the violent vomiting, it's emptying the entire content of the stomach. So not only bile is exited into your vomit, so there's usually some bile mixed with the blood and also the vomit as well. The stomach contents and also the inner lining of the stomach is also been vomited out. So what it leads to is another condition known as gastric erosion, which means the stomach acid is actually eroding the gastric walls. Now, this can cause some abdominal pains as well, and this will actually force more gastric secretions, and then it can lead to gastric reflux entering into the GI tract, and then this acidic substance can actually cause secondary damage, scarring, heartburn, and even more bloody vomit. So it's actually a vicious cycle, and when this process doesn't stop, this can actually last for the entire pregnancy period, preventing these women to actually eating properly, drinking any fluids, and also they're unable to take any anti-nausea medication, anti-vomiting medication. None of it's going down, and in fact, if you are to try these types of medication, none of it will actually be working, because these medications only deal with the symptoms and they are designed for you to actually rely on them. So if you do take them, you need to take them for the entire pregnancy period, and furthermore, they are not effective in stopping you from vomiting this type of blood. That's why in Antai Hospital, we specialize in Hyperemesis Gravidarum. In our 20 years of experience, we do offer our HG vaccine, which actually works and can actually stop the vomiting. Now, this is one of the first symptom reliefs that you can actually observe upon receiving our HG vaccine. Now, what's causing all this constant spasming, the constant erosion of the gastric glands, the stomach acid reflux? What's causing this bloody vomit is actually due to the constant stimulation it's receiving from the vomiting center in your brainstem. Now, these locations are all covered with abnormal receptors that only HG patients have, and it's hypersensitive to HCG. So your body is actually having a sort of hypersensitization reaction towards HCG, which is only happening during pregnancy. And then it's sending out signals to the stomach glands, the GI tract, to constantly contract, secrete, causing this non-stop vomiting to occur to the point where damages occur and it leads to blood mixed into the vomit. So very likely there is some form of damage in your GI tract, your esophagus, tearing of muscle or vein, and also the erosion of the stomach. All of these are factors that contribute to presence of blood in your vomit. So treatment, you have to receive treatment that actually deals with the underlying root cause to stop the overstimulation, the hypersensitization reaction, which is what our HG vaccine does specifically. Now, this deals with the underlying root cause, and once you receive it, within a few days, you will fully recover. Not only do you stop vomiting, you are able to regain your appetite. Now, that's the most important thing, because when violent vomiting occurs, it usually leads to starvation and dehydration during pregnancy, which is very bad for the child because it can lead to a stillbirth, an unwanted miscarriage, because the mother is losing so much weight. So our HG vaccine is our assurance and also our promise to all our HG patients out there seeking effective treatment. This treatment works and you can observe the results for yourselves, and you can share your experiences here at Antai Hospital to more HG patients out there. Let them know that there is in fact a cure for this dreaded disease, and it is only available in Antai Hospital. So please get in touch with us if you'd like to find out more information. If you'd like to receive this treatment, visit the website, set up a consultation, talk to our doctors here, and we can make some arrangements happen. Now, stay tuned to the next video and also leave me some comments down below.